All right, I think we can go ahead and kick things off. Thank you, everyone, for joining us. Good evening, and we're so pleased to have you here for our webinar on overactive bladder in men. This is going to be presented by Dr. Bradley Gill, and we're honored to welcome him today. Dr. Gill is a board-certified urologist and staff physician at the Cleveland Clinic's Glickman Urological and Kidney Institute. His practice focuses on men's health and improving quality of life, with a strong emphasis on communication and truly understanding how a condition like overactive bladder affects each individual. In addition to his clinical work, Dr. Gill holds a Master of Science in Physiology and Biophysics and is an active researcher and educator dedicated to improving patient outcomes in urology. So before we begin, I just want to tell you a little bit about who NAFC is. We are a 37-year-old nonprofit who is dedicated to improving the lives of people with incontinence and other bladder and bowel disorders. We're the leading source of public education and advocacy about the causes, prevention, diagnosis, and treatments and management alternatives for incontinence. And we serve patients who are living with bladder and bowel conditions, their caregivers through content on our website at nafc.org. We have a weekly newsletter, and we also have a podcast called Life Without Leaks, which features expert and patient discussions around incontinence and other related conditions. We also have several social media channels, Facebook, LinkedIn, Instagram, where we're very active, and you can find us. So now I'm going to hand it over to Dr. Gill to present the webinar.
All right. Thanks, Sarah. So it's really a pleasure to be here tonight, and I have the opportunity to talk about a topic that I'm very interested in and that I think is really a big factor that impacts a lot of patients and is a major issue in men's health, but is often unappreciated. So as the title of tonight's webinar hints at, urinary problems in men aren't always a prostate problem. Men can get overactive bladder too. And we're going to break up tonight's webinar into a few sessions, a few different topics. The first is just an overview in general of what overactive bladder is, as well as urge incontinence and how those two go together. Some discussion of how overactive bladder can impact men in particular, what some of the treatments are that we have available for overactive bladder, and how the prostate and overactive bladder can often come into play with one another. And then lastly, wrap up with a discussion as well as some question and answer. So without further ado, we'll jump right on in. All right, so what are overactive bladder and urge incontinence? Overactive bladder, if you look at the definition, is characterized by urinary urgency or a feeling that you need to get to the bathroom very quickly, and it can be accompanied by daytime frequency or nocturia. Nocturia is another word for urination at night. This can be in the absence of a urinary tract infection or other detectable disease. So in other words, overactive bladder are these type of symptoms, having to go urgently and frequently without another cause, like a urinary tract infection, which can cause those type of symptoms to occur as well. Urinary urgency, if you look at that in particular, and again, that's that need to rush to the bathroom, is a symptom of overactive bladder in only about 16% of men. And this is characterized by a sudden urge to urinate, and it really is a hallmark symptom of overactive bladder. The important thing to know about urinary urgency is it can or cannot be accompanied by urinary incontinence. So urge urinary incontinence is when a man will have urinary leakage with a strong urge to urinate, feeling like he needs to rush to get to the bathroom. Oftentimes, your patients can describe this as not getting to the bathroom on time, and it can be a major problem for many, many men. So overactive bladder is a very common condition. If you look at the amount of patients afflicted by overactive bladder, it's over 30 million in the United States. And that's in patients that are age 40 or older. We know that overactive bladder is common in both men and women. And if you look at how things change by age, what you see, and in the graph on the right here, is that the rates of overactive bladder and bothersome overactive bladder symptoms are more common in women in younger age groups, but in the 50s and 60s, the trend switches and men become more afflicted by overactive bladder in the 60s, 70s, and later decades of life. Patients that have overactive bladder oftentimes cope with this by changing their lifestyle. And this is usually in a way that's not optimal and can prevent them from enjoying time with friends and family. Some of the strategies that patients often use to reduce urinary urgency, urinary frequency, and urge incontinence are restricting liquid intake or purposefully dehydrating themselves, paying careful attention to where the bathrooms are. So a lot of times patients will come in and talk to me and say, hey, first thing I do whenever I get somewhere is I go and find the bathroom. Maybe even before I say hello to people at a party, I want to know where that bathroom is. Oftentimes patients will avoid social situations. So avoiding parties, family get-togethers, going out with friends can lead to a sense of withdrawal or isolation in some patients. Many patients who have severe overactive bladder will use absorbent products to help manage leakage, and that can be pads or absorbent undergarments, what some folks may refer to as diapers. Patients oftentimes will avoid being intimate with their partners and loved ones. And last but not least, patients a lot of times turn to wearing dark clothing to hide accidents. If they happen to wet their pants, it's less obvious if they wear dark colored clothing. They don't see a large sweat spot there. The important thing to recognize here is that these type of coping strategies are very common in overactive bladder. Over 70% of patients who have overactive bladder will engage in one or more of these strategies and change their daily behavior to try and manage their condition. Unmanaged overactive bladder and urge urinary incontinence can lead to negative outcomes and actually cause some pretty serious health issues. Patients who have these problems are at an increased risk of having falls, and that often happens at night, in particular if they're rushing to the bathroom. And if you think back to that graph, in the older population that this condition can afflict, that can lead to breaking bones or fractures and mortality or an increased risk of death. So this really is quite a serious problem. Urinary tract infections can be common in these patients, and they can lead to an increase in antibiotic use. That can place patients at risk for a higher rate of having antibiotic-resistant bacteria in their urinary tract, which can cause severe infections and infections that may require hospitalization for treatment. Skin irritation from chronic dampness due to urine leakage is another huge problem that you can see with overactive bladder. This can cause wound issues related to pressure ulcers or other skin changes related to the chronic inflammation and dampness that can occur. Worsened physical function later in life is another thing that's very common in patients who have overactive bladder, in particular those with urge incontinence. And as you saw in the prior slide, the coping behaviors, avoiding social situations, engaging with partners, being intimate, those type of things, can lead to increased rates of depression and isolation in these patients. Hospitalization and long-term care placement can be more common in patients who have urge incontinence and overactive bladder. And that can present a cost for not only the patients, but also a burden to them and their families. So in general, overactive bladder and urge incontinence tend to be very serious issues, although maybe not ones that are talked about commonly in terms of males or the overall population. So where does overactive bladder come from? It comes from the bladder being irritable. What I commonly tell patients is when they come in, overactive bladder is a problem that's more common with age. As the bladder becomes older, it tends to become more impatient, and the way that that presents is with urgency. So no longer does your bladder tell you, hey, I need to go to the bathroom in a few minutes. Instead, it's, I need to go to the bathroom right away. You've got to get me there, or I'm going to leak. The bladder also becomes more irritable with age. And what I mean by that is it becomes more sensitive to certain triggers or what we call bladder irritants. There's things that patients can eat and drink that the bladder won't tolerate as well as it used to. There's other factors that can relate to overactive bladder as well. And these can be constipation, where the bowel builds up stool and it actually compresses the bladder and the prostate. It puts pressure on them and prevents the bladder from filling up in a relaxed manner and holding urine. So constipation can actually cause overactive bladder. Limited mobility or not being up and walking around as active as folks used to be, that can be another risk factor. And it can be a risk for incontinence in particular if it takes folks longer to get to the bathroom. Prostate enlargement, believe it or not, is also associated with overactive bladder. And prostate enlargement is a very common thing in men as they age. I often tell patients your ears, your nose, and your prostate are the parts of your body that will grow your entire life. So going a little more in depth and thinking about the bladder irritants, getting back to the bladder being more irritable with age, there's 5 major ones that patients really should be aware of. And they are caffeine, alcohol, sweeteners, flavorings, and colorings. And if you take pause and look at the picture here, you see that these things are present in many of our normal day-to-day fluids that we consume. So helping patients be aware of that and how that may impact their condition is really of value. Getting a little more in detail about the connection between the bladder and the prostate, benign prostatic hyperplasia, or the growth of the prostate with age, and overactive bladder are connected. BPH, or prostate growth with age, can cause bladder obstruction and can block the flow of urine out of the bladder through the urethra. This can cause a number of symptoms when folks urinate or voiding related symptoms. Those can be a slow urinary stream, an intermittent stream or a flow that starts and stops during urination, straining or having to push or squeeze to get urine out, a dribbling stream or a slow flow that trickles, and a sense of incomplete emptying. Now, moving over and thinking about overactive bladder, those type of symptoms are what we consider more to be storage-related symptoms or symptoms that patients have when they're trying to hold their urine. And that can be frequency, feeling like they have to urinate too frequently or too often. Urgency, we've talked about this, that desire to get to the bathroom quickly, having to rush there. Nocturia, or nighttime urination. And incontinence, the involuntary leakage of urine. In many cases, these symptoms of prostate enlargement or BPH and overactive bladder can overlap. And one thing that we know from research is that if there's prostate enlargement or BPH, it can cause what's called bladder remodeling. And what that is when the bladder muscles strengthen and they get bigger and larger to try to push harder to get the urine out through that big prostate. Those enlarged muscles in the bladder, that bladder remodeling that happens, can relate in overactive bladder for patients. So in men that have had years of prostate blockage from BPH, they can develop overactive bladder. Other causes of overactive bladder also warrant attention. Stress, habits, and environment are major considerations with overactive bladder. The bladder responds to all of these different things. Neurologic conditions, strokes, multiple sclerosis, Parkinson's disease, and spinal cord injuries can cause neurogenic overactive bladder, or overactive bladder that's related to some type of disorder in the neurologic system. Diabetes is another frequent cause of overactive bladder, and that's often because sugar spills from the kidneys into the urine. And when that sugar's in the urine and it hits the bladder becomes very irritated by that. And it tells you, hey, get this out, I have to go, we need to empty this. So as you can see here in the image on the right, that's a picture that you get if you ask artificial intelligence, hey, show me a picture of overactive bladder. A bladder that's saying, hurry, hurry, I have to go, I have to go. And that fits very nicely in line with what you hear from patients. So how does overactive bladder impact men? If you look at research, men will tell you that they're far more bothered by overactive bladder symptoms or storage symptoms than they are from BPH symptoms or prostate blockage symptoms. And if you dissect it out, what you see is that these storage symptoms, urgency, frequency, urge incontinence, those type of things, tend to have a greater negative impact on patients' quality of life, or what we abbreviate QOL. If you look further into this, men who have multiple symptoms tend to have worse quality of life because the symptoms compound and they overlap. And all across the board, if you look at men who have overactive bladder and who have storage symptoms like urgency, frequency, and urge incontinence, what you find is that these are the most commonly reported lower urinary tract symptoms in men of all ages. So again, overactive bladder is frequent in men. And if we think back to the graph that showed the ages, you see that it increases as the decades go by. So circling back and talking a little bit more about how prostate enlargement, or BPH, can impact overactive bladder. What we know is that an enlarged prostate can significantly impact the lower urinary tract. Hyperplasia, or growth of the prostate's transition zone, that's the middle of the gland around the urethra, can grow and can obstruct urine flow. And you can see that in the figure on the right-hand side here. A normal prostate's on the left, and the urethra is a nice open channel that runs down the middle of it. And then on the right, you have BPH, or benign prostate growth with age. And you see that larger prostate really kind of pushes in and obstructs urinary flow out through the urethra. The other thing that you can notice is the bladder in the right-hand side looks bigger and thicker, what we call detrusor hypertrophy. And that's the bladder remodeling that was mentioned on the prior slide. So those bladder muscles have gotten bigger and stronger from having to push that urine out so hard through that enlarged prostate. So this obstruction that happens over many years from the prostate causes adaptive changes in the bladder. It causes that bladder muscle to really enlarge and hypertrophy. That can result in an overactive bladder, or detrusor overactivity, as well as a decreased bladder compliance, or a bladder that's more stiff, one that can't relax and stretch and hold urine as easily. Over a very long period, the bladder can actually deteriorate and have a weakened bladder muscle, or a decreased detrusor contractility. And that can cause problems with efficient emptying or urinating. The trabeculation, or irregular thickening of the bladder wall, those bladder muscles that get bigger, is a hallmark sign of obstruction from something blocking urine flow. And another way to think about that is, if you go to a weight room and You lift weights in the gym, your arms get bigger, the muscles get stronger. The same thing happens if that bladder has to push more to get the urine out. That muscle works harder and it enlarges. As mentioned, age is a significant predictor of BPH. As the decades go by, enlarged prostates are far more common in men. And what you see, if you look at that by age, is that about half of men over the age of 50 have prostate enlargement, and over 80% of men by age 80 have that issue as well. The development of symptoms from prostate enlargement increase steadily with age. And interestingly, if you look at the research, the estimate is that prostate volume or prostate size increases about 2.5% per year. So, when a patient comes into my office and they say, "Hey, doc, I'm really bothered. I'm urinating frequently. I have frequency. My stream's very weak. It's very poor. There's not a lot coming out." Part of my job is to figure out, do they have prostate enlargement or do they have overactive bladder? Maybe some combination of both. One of the ways I think about this is thinking about a bottle of ketchup. So in overactive bladder, you have a bladder that's very spastic and very irritable, and it won't relax and it won't fill up with urine. It won't hold well. And what happens is the bladder fills up just a little bit and then says, "I gotta go, I need to pee." And you go in and you try and urinate. That's like squeezing an empty ketchup bottle. You squeeze an empty ketchup bottle, it's going to sputter, it's going to splatter. You're not going to really see a good flow of ketchup out of the bottle on top of whatever you're eating. If the bladder can relax, if the bladder can fill up with urine and it can hold nicely, then there's a greater chance that you're going to go in and it's going to empty out that large volume with a nice, smooth, steady stream. So that's your full bladder. That's the full ketchup bottle. So this analogy folks tend to really identify with. It's easy to comprehend. An empty bladder that's emptying frequently, it's like trying to empty a ketchup bottle that has very little inside of it. So, what are some of the treatments that we have for overactive bladder? This is where there's a lot of evidence and a lot of guidance available to us. So the first step we usually think about are behavioral modifications, getting back to those bladder irritants that we talked about. And if you remember, there's 5 of them: sweeteners, flavorings, colorings, caffeine, and alcohol. Another strategy is timed urination, trying to get patients to get to a normal interval, which we think about as 2 to 3 hours. Medications are very effective for overactive bladder, and those fall into 2 categories: beta-3 agonists or anticholinergics, both of which help relax the bladder and allow it to hold urine. Physical therapy is another great option for overactive bladder. That's a strategy where patients can learn exercises to help suppress bladder contractions and urgency, help the bladder relax, and then improve their ability to regain control. Electrical neuromodulation is another treatment available for overactive bladder, and this can be done by placing electrodes on the sacral nerve with sacral neuromodulation, the posterior tibial nerve with posterior tibial nerve stimulation, or some other potential nerve targets. Chemodenervation, or what some people will say is chemical denervation or chemical neuromodulation, is another option. And that's where you inject botulinum toxin or another similar type of medication into the bladder muscle to help it relax and reduce overactivity that way. The treatment of overactive bladder is often governed by guidelines. There's a number of these available from a variety of professional organizations based on the location or place that a patient and a practice may be. These generally center upon patient education, so helping patients understand more about overactive bladder, bladder irritants, and how to manage things. Shared decision-making is really an important part of all of these guidelines. Overactive bladder is a quality of life issue. We know that. So understanding what's the biggest bother to your patient, what their goals of treatment are, and where they hope to get with management of their condition is really key to all of this. The newest guidelines really put all of the options as being available to patients from the go. So on that slide we saw before, medications, physical therapy, neuromodulation, all of those things can come into the discussion up front. Combination therapies are also something that could be considered in some cases of overactive bladder, where you take treatments from those different groups and put them together. What you can see here is a snippet from the American Urological Association and the Society of Urodynamics and Female Pelvic Medicine and Urogenital Reconstruction Overactive Bladder Guidelines. These were released in 2024. But what you see in the boxes are the non-invasive therapies, bladder hygiene, irritant avoidance, pelvic floor, physical therapy, the medical therapies that we touched on the prior slide, beta-3 agonists and anticholinergics, and then the minimally invasive therapies or the procedures like neuromodulation or botulinum toxin injection. So the guidelines are quite comprehensive and they really serve as a nice basis for managing patients and making treatment decisions. Now, the AUA, the American Urological Association BPH guidelines, the prostate enlargement guidelines, also recognize that overactive bladder can happen in these situations. So looking at these guidelines, what you see is a very similar approach where you start with paying attention to the type of fluid and the amount of fluid that you're drinking, seeing how you do by improving those, then maybe moving on to some diagnostics to see if prostate enlargement is there or prostate obstruction or overactive bladder. And if you see that a patient has overactive bladder, then going over and considering those overactive bladder guidelines for treatment. So it's kind of nice to see that in terms of common male urinary problems related to BPH, overactive bladder is part of the considerations. So how does the prostate impact overactive bladder? As discussed, prostate enlargement or BPH and overactive bladder are common conditions. Treating the two conditions can be complex. In terms of the medications that we often use, some of them can help improve both BPH and overactive bladder conditions. Others may potentially worsen one, but help improve the other. So deciding what to do is best done with an informed conversation with your physician or your healthcare provider. Surgeries for BPH are aimed at opening the prostate and reducing the reduction to flow of urine. In doing a BPH surgery in a patient that has overactive bladder, it's important to recognize that in some cases, the overactive bladder can persist and it can result in urgent incontinence that continues after surgery. In other cases, the overactive bladder may improve or resolve once the BPH is treated and the bladder has an ability to relax. So it's very important that patients understand that going into these treatments, that we may not know how the overactive bladder will respond to BPH treatment going forward. In many cases, an iterative treatment or a stepwise treatment is necessary. So you may want to address BPH first, in some cases, overactive bladder first in other cases, and then go from there. So having discussions with patients, helping them understand what's happening with their bladder and their prostate is very helpful in guiding decision-making. Looking back to the overactive bladder guidelines, just as the BPH guidelines recognize overactive bladder, the overactive bladder guidelines recognize the impact of BPH. And what they mention is that in patients who have overactive bladder with BPH, you can consider treating them with your typical overactive bladder medications, like anticholinergics, which are sometimes called antimuscarinics, or beta-3 agonist medications. Combination therapy with BPH medications like alpha blocker and the overactive bladder medications like antimuscarinics or anticholinergics or beta-3 agonists, combining those BPH and overactive bladder medications can be effective in some patients. And then lastly, thinking about the overall treatments, conservative therapies like behavioral modifications, medications, or procedures for BPH, all of those things come into play. But again, it's an informed discussion with your patient. So these various treatment approaches can be very effective for a number of cases. Considering the combinations that can be done in terms of medications, it's important to understand the side effect profiles of the different drug classes that can be used and the emerging evidence on safety of some of these medications. But again, stepping back and looking at everything, overactive bladder and BPH are often major quality of life problems for patients. And this is where patient counseling is key, and having that discussion between healthcare provider and patient is of the utmost importance. Setting goals for treatment and making sure that we're aligned in what we're trying to do to help. So overactive bladder treatments in men, we know that there's different medications available. There's newer medications like beta-3 agonists. There's older medications like anticholinergics. There's also the injection of medications into the bladder, chemodenervation or botulinum toxin injections, and neuromodulation, thinking about those different nerve targets that we can hit to help calm down the bladder. So with that, we'll tie things up here and then we'll move over to Q&A and discussion. As mentioned here, overactive bladder in men is very common. It increases with age, and we know there's other factors like constipation and bladder irritants that can cause it. Patients many times will change their behaviors. They may even shy away from seeking care for it. So despite it being a common condition, in men, it may be under-recognized and undertreated. Overactive bladder has many effective treatments available for it. We have guidelines that really help us outline and organize these, and they support lifestyle changes, changing fluid intake, medications, procedures, and that treatment really is guided by shared decision-making between healthcare providers and patients to make sure that we understand patient goals and we can tailor treatments accordingly. And last but not least, as has been discussed, men can have overactive bladder as well as BPH. So contrary to historical thinking, if a man comes in with a urinary problem, it's not always the prostate. So with that, we'll wrap it up and we'll go over to Q&A here. I'll turn it back over to our NAFC team.
Thank you so much, Dr. Gill. I just want to mention before we jump into Q&A that we do have a lot of resources available to patients on our website. We have a message board community where you can connect with other people who may be dealing with the same kinds of conditions and questions that you are, and they're a great resource just to bounce ideas off of or just to vent or connect with. As I mentioned before, we have a Life Without Leaks podcast that we update regularly. We have a Find a Doctor tool on our website where you can go in for a specialist near you, a patient newsletter sign up, free printables. So all of these will be shared with you in an email following this webinar, but just keep an eye out for that. We'll also include a link to this recording too, so that you can rewatch if you have any additional questions or want to revisit this. But if anybody has any questions, please feel free to add them to the Q&A, and we'll try to get to as many as we can. I know a few came in prior to the webinar, so we can try to answer those while you add others if there are any others.
Thanks, Sarah. Yeah, I can go through those questions. For those attending, if you're looking for the Q&A box, if you put your cursor down at the bottom of your screen, there should be a little box for Q&A, and there should be an opportunity for you to put your question in there. And I think there's even a box you can ask it anonymously. So if there's any questions, take a look at that. So Dr. Gill, thank you so much. It was a great presentation. I particularly loved the impatient and irritated bladder visual. It's a good way to think about it and look at it. So we have a few that folks wrote in. So the first one is, I've heard that acupuncture can be helpful to treat OAB. Dr. Gill, do you have any experience or opinion on its use?
That's an excellent question. So there actually has been some research into that area. And in particular, if you look at some of the neuromodulation techniques that are used for overactive bladder, like posterior tibial nerve stimulation, those nerves that are further downstream in certain parts of the lower extremities, they come from the same nerve roots that the bladder is innervated by. So just like neuromodulation can help calm down the bladder by stimulating those nerves, there is some thought that acupuncture may work by a similar mechanism. We don't have the level of evidence for acupuncture that we have for neuromodulation. Neuromodulation being an FDA regulated, FDA approved treatment. But yeah, that's a great question and kind of a similar thing to what's happening in those areas.
Great, thank you. Here's another one. Are there any newer treatments like stem cell injections available to address these problems?
That's another great question. So regenerative medicine in general, stem cells, different types of cytokines, regenerative treatments, there is a ton of research being done in this area, looking at nerve growth factors, looking at different things that regulate bladder behavior and bladder receptors, all of those different things. There hasn't been any, home run, so to speak, in that domain yet. But it's an active area of research. There's a lot of laboratories looking at this. So my answer to that one would be stay tuned.
Yep. Okay, how about bladder stone impact on OAB?
That's another great link between BPH, prostate enlargement, and overactive bladder. So in BPH, prostate enlargement, you can have bladders that don't empty very well. The bladder can't squeeze out all of its urine through that big giant prostate. And if you have urine that's left over in the bladder, it kind of stagnates, and then debris can settle in there and form bladder stones. You might also even drop a little kidney stone that can't find its way out, and it can become a bladder stone. What happens is those bladder stones roll around inside and they rub the lining of the bladder. They irritate it and they stimulate the same nerves that make you feel like you need to urinate. So bladder stones can be a cause of lower urinary tract symptoms and overactive bladder symptoms.
Thank you. The next one is, I read about Bulkamid injection is now being used as off-label treatment for men. What is your thought about this?
That's an interesting question. So that relates more to stress urinary incontinence and not as much urge urinary incontinence. Stress urinary incontinence is a leakage that can happen when the sphincter muscle, the valve that opens and closes to let the urine out, doesn't close very well. And those injections are, as mentioned, an off-label treatment. There's something that has been researched and kind of looked at for a very long time to see if it can help men with stress urinary incontinence, but not really any role for those in urge incontinence.
Thank you. Okay, next one is, can bladder infections scar the bladder and reduce bladder volume?
That's an interesting question. So, repeated infections anywhere in the body, chronic inflammation, can lead to tissue changes. And when that happens, you can see changes in the bladder in terms of bladder compliance, its ability to function, and those type of things. I don't think there's any good research on this. It'd be a very hard thing to kind of prove or disprove, so to speak. But I think there have been some retrospective looks at this to show that patients who do have chronic cystitis or chronic inflammation of the bladder, and inflammation of the bladder can come from infection, but chronic cystitis can cause kind of a stiffened bladder that may not work as well.
Great. What about urinary retention? Is that considered an aspect of OAB or not?
Excellent question. So urinary retention, or the inability to urinate, relates more to a backup of urine and being unable to empty the bladder. Men who have urinary retention can have urgency and frequency and small volume urinations because they go in, they pee a little bit, but they don't really empty out the bladder, so to speak. Those men can also get what's called overflow incontinence, where they may leak, the bladder literally overflows. And that can look like urgency, frequency, or urge incontinence in some cases. So I wouldn't call it overactive bladder in the sense of a spastic or an impatient bladder, but urgency and frequency and that sensation of urge incontinence can happen with urinary retention. We call that clinically overflow incontinence.
Awesome. I think we just got a couple more here and we'll wrap up. Is there a link between non-invasive bladder cancer and OAB?
That is a wonderful question. So some bladder cancers can cause symptoms of urgency, frequency, and pain in the bladder. So getting back to what we think about the definition of overactive bladder being, it's urgency, possibly frequency or nocturia, in the absence of another explainable cause or another explainable disease. So in those situations, if you had urgency and frequency, if you had overactive bladder symptoms, but you had bladder cancer, we wouldn't consider it to be overactive bladder. We would attribute it to the bladder cancer. The same thing could be said for that bladder stone, in terms of the question that was asked earlier.
The next one, I think you might have to help me decipher this one. It says, comment on external beam radiation to prostate as an irritant to bladder causing urgency.
Yeah, that's another very fitting question when it comes to prostate and bladder overlap. So prostate cancer can be treated with surgery and it can be treated with radiation. There's also some other treatments that aren't quite on the guidelines yet, but are frequently used. Radiation treatment, when it impacts the bladder, the prostate sits right below the bladder. Some of the radiation can impact the lining of the bladder. And what can happen after some years is that you can develop an irritable bladder. You can develop what's called radiation cystitis, where you can have changes in the lining of the bladder, and it can be more sensitive to irritants. It can be more irritable, and you can develop overactive bladder type symptoms a few years after radiation treatment. So that is something that can happen. It's less common nowadays than it was historically because radiation treatment in the current, the modern era is able to be more precisely focused, and there's less kind of collateral radiation to tissues.
Awesome. Thank you. I think we've got one last one. My PT has prescribed constant diaphragmatic breathing as a very effective treatment for OAB. Do you agree with this approach?
I agree with pelvic floor physical therapy for overactive bladder 100%. So there was a study years back where men who had overactive bladder had physical therapy and they got this much better. And men who had overactive bladder were given medication and they got this much better. And when you put both those things together, the guys got that much better. So physical therapy is a very effective treatment for overactive bladder, and it can focus on relaxation techniques to suppress urge, a number of different things. So yeah, that's a very, very good question and a very good insight into what's a very effective treatment for overactive bladder.
Awesome. Well, I
That's
think
great.
that's it. We got a comment to do a similar one on SUI in the future. So I think this was really informative.
Sounds
Yeah.
good.
Thank you so much, Dr. Gill, for sharing your expertise with us and your time. We really appreciate it.
Happy to help, and thanks again for having me. Again, really happy that we're able to have this conversation because overactive bladder in men is common. We see the statistics, but it's not something that we really talk about or recognize as much as we should. So remember, if a guy has urinary troubles, it's not always the prostate.
It's a good note to close on. Well, thank
Have a
you.
good
As I
night.
said, we will be sending out a follow-up email with our resource links and then also a replay of the webinar. So keep an eye out in your inbox for that, and we'll talk to you soon. Bye.